There we go. Technical difficulties figured out. It's only year 3 of the pandemic of Zoom life. Okay, welcome everybody. My name is Sivan Amar. I'm founding incorporating member of Medicare for All Connecticut. Medicare for All Connecticut is a grassroots volunteer-run organization advocating for Medicare for all on the local, state, and national level. We believe in people over profits, that healthcare is a human right, and that your health should never be traded on the stock exchange or in the hands of anyone but you and your chosen medical professional. We have written statewide legislation, passed town resolutions, and endorsed candidates who support our vision of a universal single-payer system in which transparency, public accountability, and a more equitable approach to healthcare is possible. If you believe the same, please join our movement by subscribing to our newsletter, following us on social media, joining one of our committees and working groups, and donating to our cause. You can check out our website for a ton of articles and resources on single payer, upcoming events, actions you can take, and other ways you can get involved. So we just dropped a ton of links in the chat there, but those are ways that you can get involved. Some organizational updates. We've just submitted our application for 501c4 status. So that's very exciting, and we want to have a special thank you to Rana Stoller, who helped tremendously. We wouldn't have been able to do it without her writing the application. Once granted that status, we will have official nonprofit status and be able to support legislative and political actions officially. The application fee was not cheap, so please consider making a monthly recurring donation to Medicare for All to rebuild our coffers. We are researching options for also applying for 501c3, which will allow us to focus more on educational research and outreach. However, there will be application costs for seeking that status as well. So please do consider making a much needed donation tonight. Okay, we are, and I'll put that in the chat too. We're also opening our board of directors, advisory panel, and steering committee positions to our general membership. If you're interested in joining our fight for universal health care, please email us at info@medicare4allct.org with some information about yourself, and we will reach out to you. We definitely need help with running this show, so we'd love to have you along. Okay, so last year, the Connecticut General Assembly passed legislation extending HUSKY Medicaid coverage to undocumented immigrants who are pregnant and aged 0 to 8 years old. We at Medicare for All worked with the HUSKY for Immigrant Coalition to advocate for this much needed change. This year, we are again supporting the HUSKY for Immigrants campaign, this time seeking to extend coverage to undocumented children through the age of 18, so up to the age of 19. On Thursday, March 10th, this week, Senate Bill 284 will have a public hearing in the Human Services Committee. Please consider taking the actions we will be discussing here tonight with our guest speakers, which we'll list in the chat. And you can also check on their website. There's HUSKY 4, the number 4, immigrants.org. We will have a Q&A period after hearing from our guest speakers. Throughout their presentations, you're welcome to put your questions in the chat and we'll collect them to ask the speakers. Though you may know the answers to the questions yourself and want to put the answers in there, please be considerate of the speakers who have donated their time to be here and answer, and they will answer those questions directly, though we do appreciate everybody's enthusiasm. And so now on to our guest speakers. So our guest speakers tonight are two amazing young women who I look up to as real heroes in the struggle for healthcare justice. Katia Daley is the healthcare campaign organizer with Connecticut Students for a Dream. Connecticut Students for a Dream is a youth-led organization that fights for the rights of undocumented youth and families through leadership development, advocacy, and community education. Katia leads the Husky for Immigrant Coalition, whose main goal is to fight for policies to expand healthcare access to all immigrants, regardless of status, and open eligibility to the Husky Health Program. So snaps for that. Brigith Rivera is the Husky for Immigrants campaign fellow working for Connecticut Students for a Dream. She was born in Peru and raised in the greater Hartford area. Her professional goals are to study law and continue to work with grassroots organizations to address health access, housing insecurity, and the mental health crisis. Katia and Brigith, take it away.
Thank you, Sivan, and thank you all so much for having us here today. I will start by sharing out my screen. So that was a beautiful introduction. So just restating what Sivan said, my name is Katia Daley, healthcare campaign organizers with Connecticut Students for a Dream, and I will be co-facilitating this presentation with Brigith Rivera. Just a little bit more information about the Husky for Immigrant Coalition. We are a statewide coalition that works with different advocates, healthcare advocates, healthcare foundations, grassroots organizations, and healthcare professionals to fight and advocate for policies that would expand healthcare access to all immigrants, regardless of status, and open eligibility to Husky health programs here in Connecticut. So I wanted to discuss a little bit about the Connecticut uninsured rate and the statistics and how that looks like for our undocumented community here in Connecticut. As at this point from the migrant policy report, there is a 5% uninsured overall statewide, and that number contrasted to the 52% of uninsured undocumented communities is a very staggering gap that we see in this data point. Total Connecticut uninsured individuals are estimated at 180,000 in 2018. And between 53 to 68% uninsured undocumented immigrants in Connecticut. So if the state of Connecticut wants to decrease these gaps in the uninsured rate, it must work on expanding Husky coverage to our immigrant community and our undocumented community. So what are we doing at Husky for Immigrants Coalition to fight that, to close that gap, and to advocate for expansion of Husky programs? So in 2021, we had a really successful legislative session. It was a bittersweet legislative session as we were at the community, as the Health Services Committee, we were able to advocate for expansion of Husky for all, as in all immigrants, regardless of status and regardless of age, where we were able to advocate on a Thursday, the 11th, which is kind of funny because our public hearing this week is Thursday the 10th, but it was an 8-hour public hearing with community members were able to speak in their own languages. Actually, we had a lot of Spanish speakers and we had interpreters share their stories to the Health Services Committee, and we had 90 people speak and 150 people submit testimony last year. And through that advocacy, we were able to put pressure on the legislators. And though unfortunately, that bill did not pass the House or the Senate, another bill, HB 684, 6884, I think it was the number, was able to go both in the Senate and in the House, and it had good support from our legislators and was able to pass and be signed into law. So that's what we, Sivan was talking about at the beginning of the introduction, where we were able to expand the Husky programs to pregnant pregnant women for the expansion of the prenatal care services and also the 1-year postpartum services. And so these are for pregnancy and labor services that will be available under Husky program. Also the expansion of Husky to children up to the age of 8. So at 9-year-old, at this point, we have members of the community that would age out or be left behind if the bill that we're supporting now does not pass. So this is a good start as we are seeing some increases in healthcare accessibility to some of our undocumented community, but it's not enough. And then the other thing that we want to point out and kind of uplift as well, it was not part of the legislative session per se, but after the legislative session started, we had a lot of community members and healthcare advocates rally up behind the emergency Medicaid expansion because we had community members within the specific one for in Yale Hospital that she had been in the hospital for 7 months, stuck there because she couldn't get the dialysis services, outpatient dialysis services. So unfortunately, a lot of undocumented immigrants, due to chronic illnesses, the services that they needed to provide that could be outpatient, that could continue to not disturb their lives, they had no access to that whatsoever. And so they would wait until it was the last minute emergency, and they would go to the emergency rooms and get into medical debt at the same time. So this is some kind of relief for the outpatient dialysis services for those patients that very much need this life-saving service. And with that, I will pass it to Brigith to discuss our goals for this legislative session.
Yeah, so as you all know, last year we expanded Husky healthcare access for everyone who's under 9, but this year we have this new bill that was proposed by the legislature and we're standing behind. It's called SB 284, which is just an act to expand Husky Medicaid coverage to up to 18. And so this is going to be, as you all know, on Thursday starting at 10, and we're going to have a public hearing, which will provide interpretation for non-English speakers as well, like we did last year. And we really just need anyone and everyone who believes that healthcare should be available to all, and who have had like lack of healthcare access and know that experience, to come and testify and support this bill. We need allies, personally impacted individuals, healthcare providers, and other members of the community to stand up for our immigrant community and support this bill so we can ensure not only just a healthier state for the immigrant community, but a healthier state overall, because the pandemic has shown us that we will only have a healthy state when we ensure that everyone has Medicaid access. And unless undocumented immigrants do, then we're not going to get anywhere with securing a better state. And so to sign up to testify, there's a couple of ways you can do that. If we go to the next slide, I can talk about how public hearing. So if you already know exactly how a public hearing runs and how you can submit a testimony, then you won't need much more support. Then you can just submit your written testimony in support of SB 284 and submit it to the HS testimony at cga.connecticut.gov. SH stands for Human Services Committee, as that is the committee that the bill will be presented to. But if you will need more support, we also have templates, and even in those templates at the header, we include directions and more information as to like what can you put as a subline for your email, when's the deadline to submit the email by, what can you write in the body of your testimony, things like that. How should you end the template things like that. And we have 2 versions as well. Our team has diligently been working on, not my bad, we have multiple versions. One template for if you are an immigrant yourself and have experience to not have experienced lack of healthcare. We have another template if you're an ally and supporter, where we ask you different questions for you to better express yourself and your support. We even have a template for if your organization as a whole wants to submit a public testimony in support of this. So we have lots of templates, and you can definitely reach us out if you need that. We have a toolkit as well, in which where we can include a public hearing guide and talking points. I know we have Katia was able to get in a slide about a few data, but our team has also been working on briefings for legislators and representatives. So we have compiled all that information about, you know, how it would benefit the economy, or how it would generate better community health outcomes for everyone, including parents, including elders, including children. All of that data is all balled up into just, you know, the highlighted talking points in the document that we have created. And then we also have, if you would like more support for publics verbally testifying in this, then you can also register with us, and we'll make sure that you register. We register you for the public hearing. So you just have to register with us. There's a QR code that I put in there to make it easier. And we do all the legwork for you, including, you know, your name, email, job title, if that's, I know that's a question now, which is odd, but we include all the submission and make sure that you have notice even when you're speaking. So on Thursday, we have a team that will also be sending out messages to let you know, hey, you're number 2 out of 64. Hey, we're in number 63 right now. Watch out for your turn. Because we really value having everyone there. I know everybody's job schedule is could be very flexible, and you don't know when it will be your turn until the day before. But we just want to get all of our community members and supporters out there to let our legislature know that this is a really important issue, not only for the immigrant and undocumented, but for everyone. And yeah, so next slide is just a thank you for hearing us out. And if you have any questions, me and Katia are always here to reach out. We also launched our website recently. It's huskyforimmigrants.org. A lot of our team put a lot of effort in that, and you can read more about our history, what we try to do 2019, 2020, 2001, and what we're trying to do now. Yep, and I'll pass it back to the facilitator.
Great, thank you, ladies, so much. Let's see. Yes, thank you so much for all of your hard work, creating those templates and volunteering to sign people up is quite a task. So thank you for that, and thank you for this wonderful presentation. I just want to also note that we at Medicare for All, of course, support any push for healthcare access expansion. However, we always present the caveat that any expansion that leaves anyone behind is not enough. We will always strive to ensure that every human living in Connecticut and ultimately in America has access to their human right of health. So with that, we could not be prouder of Connecticut Student for a Dream and to be part of the Husky for Immigrants Coalition. And we will open it now to any questions anybody might have for our guests. Please feel free to either drop your question in the chat or you can raise your hand using the reaction button below. Rep. Michelle.
Thank you, Sivan. Thank you, Katia, for the presentation. I was just gonna suggest, when you guys do the testimonies, it's always better if the first sentence sometimes it's different, or even the subject. So, and I did put in like an example of the subject, but because then it grabs the attention from the reps, because if they see the same start, they skip, they say, oh, okay. Or they go straight to the bottom and look at, is that person from my district? And if they're not, boom, delete. And I'm sorry to say, but it's helpful in some way to put the address or like the town you're in, because if it ends up your rep, then that's really more powerful. And you know, but these are just suggestions, and sometimes it's hard to know when you're doing a grouping email. It's hard to know which rep it's going to. Is my rep in that committee? Don't, you know, so, but just suggestion, if you can change the wording. Sometimes when I fill out petition, because I do, I'll just change, like, you know, when you have the box where you see the language pre-written, I'll just put, instead of it say it says as a lover of, or as a fighter for social justice, I'll put as a legislator, and as a legislator on this, and then they can see the debate. I've had other legislators from other states respond. So, but that grabs the attention. Sometimes it's important because it counts as more than just a repeat of the same. So.
Yes, and from our experience, it's always better to include your own personal story. Though you might not know an undocumented person, including information about your own healthcare stories, your own healthcare issues, can always highlight the problems that we all face in the human community. So those are, there's always different ways of grabbing attention of legislators as well. Holly.
Thank you, Sivan. Thank you, Katia. And thank you, Brigith. Thank you so much for being here and continuing all of your hard work. I just want to make sure everyone is aware that this is tomorrow. The deadline is 3 o'clock for testimony and to sign up. So please make sure that if you're going to sign up for public testimony, you do it by 3 p.m. tomorrow, in everything in every way that you know, Husky for Immigrants has set it up. It's so easy. I couldn't believe the way you guys had done those forms. It's amazing. So it's really simple to do, but if you, like Rep Michelle said, if you just customize it for yourself, it's terrific. But I just wanted to make sure that we really honed in on the fact that the deadline to do this and to sign up is tomorrow at 3 p.m. And we have to get the written testimonies into the Human Services Committee as soon as possible. Each committee keeps their own rules and regulations as far as whether or not they will accept the written testimony after the hearings. I found that out yesterday. So some committees will accept after the deadline and some will not. So in other words, usually you're given until 11:59 of the day of the hearing, but some will take them for however long, but you have to call that specific committee. So please don't take that for granted and make sure you get your written testimony in as soon as possible. This is very, very important, everyone. You know, as we found out with this pandemic, you are only as healthy as your sickest neighbor. And that includes everyone. We are all included. And, you know, so I really want to make sure that everyone understands that this is so very, very important.
Thank you, Holly. I have a question for Katia and Brigith. Do you have any statistics or any information on how many children have now been covered since the expansion last year? If you could maybe even talk more to the success of that bill.
Yeah, so unfortunately, we don't have any data in regards to that due to the expansion starting on January of 2023. So the expansion of for pregnant women prenatal care services is going to be April of this year, so next month, and postnatal care services will be available for the community next, I believe next April of 2023. So we'll have more information hopefully coming up from that in regards to that next legislative session. So it helps us provide better messaging and better talking points for our upcoming legislative sessions.
Excellent. Yes, I forgot about that. And when would this take effect? Should it pass?
Should it pass, it will be just a amendment to, I believe, to the law that's already happening. So instead of 9, it will just change the language to 18.
Awesome. Fantastic. Bill, why don't you go ahead?
Yes, thank you. First of all, thank you for the excellent presentation, Katia and Brigith. It's very good. I'm on the board of the Fairhaven Community Health Center, just as an example of numbers. We have 1,400 children who are patients, existing patients who are uninsured. The vast majority are uninsured because they are undocumented. And there are over 5,000 total adults and children who are patients, existing patients who are uninsured. That's just in Fairhaven, okay? And I'm sure there's a lot more people who are not patients. We know there are a lot of people who are undocumented who won't even come to a community health center where they can get free services or low-cost services because they're afraid to do so. So it's really important to push for this bill. I'm also planning to testify, and I'm going to ask the legislature to make the effective date July 1st of this year. So thank you.
Thank you so much for the support.
Bill's the true champion of the people. We love him. I was just wondering if you can share any stories that you might have from your membership regarding their healthcare struggles. For instance, my neighbor is a social worker at the Yale New Haven Hospital in the PICU, the Pediatric Intensive Care Unit. And the stories that she tells me regarding the undocumented children who come in and need life-saving surgeries, for instance, or dialysis, as you had said, and that what the state of Connecticut does and sort of delays their care and then tries to outsource it and transfer them to either New York, where they might have relatives, or Massachusetts. It's really heartbreaking. So I'm just wondering if you have any stories that you can share with us about the care or lack of care that our undocumented neighbors receive.
Yeah. I can speak personally because I sometimes I don't like to speak from like other members due to, you know, the what it comes with the trauma inducing portions of these things, and also their stories are there to tell us we wasn't empowered. But I'm formally undocumented, so I'm in mixed status family right at this point. My father has had diabetes for 35 years. So getting healthcare for him and for us has been very difficult in regards to, you know, getting his A1C ready and done, going to community health centers. As we know, that's one option that the uninsured population goes to for preventative healthcare services. But unfortunately, due to the understaffing of it, the services that the underfunding of it all, it also is very difficult to get those services. The services are there, but the quality is also not the greatest. And unfortunately, it's due to the circumstances that we're living in. my father has had to change physicians every other year. And as we know, like it's very important to have that connection with our healthcare providers to be able to get the healthcare that we need in some senses, and has been very trauma inducing for my father to do so. And in some instances, without the healthcare provider that would understand him in his own language, interpreter services have been very lacking. The medicines have been very expensive, and I have heard stories. Thankfully my father hasn't had to go through that, but of community members that had to be rationing their medicines due to the inaccessibility of the cost of medicines. I know that that's a huge issue that we have even with the insured population, but out of pocket out-of-pocket payments for medicines are very high for my family. In regards to when I was a child for healthcare services, I g- I was in sporting events, like I play volleyball when I was in high school, and I sprained my ankle twice. And it was at a point where they wanted me to get into an ambulance and take me to the hospital. At that point, I wasn't undocumented, and I told them no because it was due to one, the fact that I didn't want to be a economic burden to my parents. Um, I told them to just let's go like go back to the high school and I'll figure it out from there. It was I was able to advocate for myself that the high school could afford to take me to the physical therapist through a program, but um what if I didn't advocate for myself, right? Like, what if I didn't know what are the resources there? And that's something that is fine every time when I'm talking to community members, that they go into medical debt because they don't know. And also the healthcare providers that are there for our community do not have all the information either. So lack of communication, lack of access to things, and figuring out what's the best option for that person, as it can be unique specific situations, has been very difficult. I was able my sprain I was able to go to therapy, physical therapy, due to the program that the high school could provide, but that's due to the funds the high school has. But if high school didn't have those funds, or it didn't have that program, I would not be able to have healed correctly. And that's also very, like, I have that very close, like that story close to my heart, because it kind of talks not only about the the inaccessibility to healthcare, but also the trauma-inducing problems of things. Because I was like very emotional and very much a mental health issue in regards to what do people deserve in regards to accidents happen. Accidents happen in life, and preventive care wouldn't have find that out. So there's also a lot of things to push for in regards to not only Husky for immigrants, but in regards to other specialties that might not cover Husky might not cover. Um, but yeah, so that I guess that's a little bit about me and my story. Brigith, would you like to share? Or
Sure, I can share. I think I have two things. First of all, the first one being, if you do want to hear more stories of their own people sharing their own stories, you can come to Thursday. And then also, if you do decide to testify, we understand how much trauma-inducing sharing our stories could be. So our team has decided to also create a space afterwards, and like give messaging, check-in messaging for when you speak to see if you are all right. We want to practice like care for our community, because that's a principle that we believe in. And so we practice that by doing it and taking care of each other. And so we also will provide that service. And then in regards to my own story, I think A lot of it hit me when I was trying to access higher education, applying for school. That process is really hard, and I think it just makes it a bit harder being undocumented. I am undocumented and unapologetic about that, but I am undocumented currently as well. And it was really hard trying to apply for schools, and it just felt like the world was on my shoulder and against me, and my parents didn't know how to support me as well. I was first generation, and so this process became really draining on me, and I got really bad depression and anxiety from it. And so accessing mental health support for that was really difficult. And at the end of the day, I didn't get the resources I needed. And I think the only thing that has brought me here, that like had was able to inspire me and push me to continue to be alive and exist in a place where I felt like I was unwelcomed and didn't feel like was for me. It was my community, and so I have my community to thank for that. I have their amazing relationships I was able to build on that, which just comes to show, I think, that beyond the policies that we push for and create, the only thing that we can really try to continue to foster is relationships, because one law isn't going to change everything that we are fighting for. It's going to be us coming together and building and doing what we believe we practice, and holding our values close to our heart. And so that's my story. And I still think that it's, we're in a pandemic, there's a big mental health crisis, and we should keep the undocumented community in mind, because those, like Katia said, those places that do offer services, clinics and community centers, they are very much underfunded and then over capacity. So we have to think about what we're leaving behind and who's getting left out and who's out of the conversation when we talk about mental health, when we talk about, access to human care, and remembering to always go back to our community. You don't need to know someone, but it's always who's undocumented, but it's always really important to stay connected to your community. And then there's 180,000 of us in Connecticut, so there's certainly someone who's undocumented who you have crossed paths with in your life. So yeah, that's all I'm going to say about that.
I just want to tell you, you are welcome. It is just the broken systems that are unwelcoming. It is not the people, especially the people that are here. We welcome you. So please don't ever feel that way. It's the broken systems in which those of us who truly do care are trying to fix. We want to tear them down and put up the ones that are right in place of them. So please, you are definitely welcome. It's just the broken systems. So thank you both for sharing so much of yourselves and your lives with us, and for helping us to see things a little bit more close to the heart instead of just numbers and data, which is everything to me. And you got me. If you see my nose get really red, that means I teared up. So I did. You got me in tears. So thank you. You really touched me. Thank you.
Yeah, if you can see the chats right now, everybody is very grateful for both of you being here and spending time with us tonight. Another thing that we do with Medicare for All is we always try to take down our opponents by throwing facts in their face and their own arguments in their faces. One of my principal beliefs is flipping the script. And a lot of times the argument against universal health care or expanding access is cost. What the general public doesn't understand is that the cost for universal coverage or preventative care is much more inexpensive than emergency services that a lot of undocumented people have to resort to because they are not covered. do you have any idea of what the costs are for the proposed bill, as opposed to what the state currently pays for emergency services that either get abandoned or result in bankruptcies for families?
Yeah, so I'm sorry, Sivan. So unfortunately, we are working on those research studies and those reports. They are going to be coming out actually on the end of May, I believe, for our report. Like we were able to Universal Healthcare Foundation was able to get some funding to study, to get a report and an economic model to see how much would it cost for expansion of Husky to all immigrants here in Connecticut with the Husky program. And that the report is going to be coming in on May. A portion of the law that passed last year was to have the offices of health strategy also create a report in regards to cost about these services, and that's going to be available, I believe, June of this year. So all that information will be available then. We do know that emergency Medicaid and like the how much the state is paying for uncompensated care, it's a lot. It's unfortunately we're not able to discern how much that is in comparison to like the undocumented community and who is using what, due to just privacy information in hospitals. But we are trying to figure out like a way on how to make those numbers more available for us, because that's definitely like we know, as like we had conversations with different hospital systems, that that they are spending a lot of money on uncompensated care, but unfortunately we don't have a way yet on how to discern that and report that. And once we have the reports that are going to be coming in on the summer, we're going to hopefully have better messaging for next legislative session. But yeah, all of these reports are great, but they're like, it's bad timing in regards to this short session.
When is it ever good timing? Right?
I
Well,
think
that's
the
really interesting.
the
Maybe, oh, sorry, go ahead, Brigith.
I think I was just looking it up because we have a portion of this of uncompensated care, and per OHS, I think statewide hospital has the total of 806 million, which is an increase from last year by 5%. And this is for like 2/3 of all hospitals in Connecticut. And as we know, uncompensated care, that is taken on by the hospital, and then they increase their pricing, and then we all just pay higher health insurance, which just affects all of us.
Yes, it does. And we also, with Medicare for All, have been working on a study bill to expand Husky for everybody, for all Connecticut residents, no matter their health status or their immigration status. And in that, we also would want for the study to include a comparison of costs for those uncompensated emergency services compared to supplying health for everybody. Rep. Michelle, you have a question?
Yeah, I'm looking at the testimony from OHS. And it's a poison testimony, which I think that if somebody could maybe work on a counter argument by tomorrow would be really good, because I'll try to read this sentence that's pertinent, if that's okay. Or if you want, I can just put the link in the chat.
You can, yeah, if you could do both, please.
Here we go. Here's the link. And in the main paragraph, OHS would like to ensure that the committee is aware that Section 5 of Public Act 21-176, which is basically based from the bill from last year, and I opened the bill from last year, which was 842 in 2021. And here is the link for that. I'm trying to find some lack of logic between what they're saying this year to this year, so somebody could address it in testimony tomorrow, because on Thursday, sorry, because I think this is where everything lies. Is OHS is going to wage in on this, and they say, oh, so this is what they have to do according to Section 5 to complete a feasibility study on adding the population ages 9 to 18 and to report back by July 1st, 2022. They're basically saying that they have to study, to do a feasibility study on adding the population ages 9 to 18, and that needs to be reported by July 1st, 2022, which is after the session, right? Which in my, maybe I'm paranoid, but in my reading this, I feel like they're saying you should wait until we get that report before we implement such, something like this. So I think this is the argument you need to try to counter by Thursday. I'll think about it. I'm looking right now. I'm looking at the bill from last year, which I would go through the bill analysis, but it's a short version, but don't trust it entirely because it's a bill analysis from a certain point of view. Sorry, I didn't mean to.
No, thank you for pointing it out. At least we have that on.
Yeah. And it's not easy. I mean, this is, the prospect is tough because, there is definitely a public hearing. So I would say the bill will pass out of committee, but then where is it going next? Is it going to appropriations? Where is it going to be killed over there? Or, what's going to happen? And we need to monitor that. And maybe some people could preemptively talk about if this bill goes to appropriations, you want to make sure that, but you have to find a counter argument to this argument from OHS. I think it shouldn't be the main priority, but some people should try and address that in the public hearing. I think it would help tremendously. Sorry, I was like, whoa, that's a poison testimony right there.
Ellen, you're up next.
Yeah, this is Ellen Andrews from the Connecticut Health Policy Project, and I used to work in the Capitol. I've been doing this for way too long. And I agree completely with Rep. Michelle. That is poison testimony. He's right. That is an excuse to do nothing. And, if you just look at this, it makes sense on its face. If it makes sense to do for children to 8, there's nothing special about turning 9, that you don't need healthcare anymore as you enter your tweens and adolescence. And if it makes sense for kids that they're going to end up costing more if we don't cover them, why wouldn't it be true for kids over 8? And so the economics really doesn't change. And I think that you should make the same argument, because honestly, he's right that's just a reason to put it off till next year. God knows what the study will come out and say. And next year, there will not be as much money as there is this year. Right now, they're flush because of all the federal COVID money. Next year, they're going to be talking about cuts and what they can't afford. And so the time is now to get this done.
Thank you so much, Ellen. And actually, with that being said, Katia and Brigith, if you can let us know of any additional actions that the Husky for Immigrants or Connecticut Students for a Dream coalition might have. Are there any phone banks, any test banking, any assistance that we can all provide or share with our own networks?
Yeah, at this point, we actually might need some support and confirmation phone banking for later on, just tomorrow afternoon, if possible. Brigith, would you be able to find that form for the phone banking to put it on the chat? And we have that text banking system happening, but that we do have members of the coalition working on that as well. In regards to other actions, we do not have any at this point. We do have a petition in our Husky for Immigrants website. So if you would like to get just in our servers list, please sign that petition as well. We are gearing up and we're like working with the grassroots organizations to do some actions, some rallies in the warmer months in regards to supporting expansion of Husky. And we will hopefully have some target areas like New Haven, Bridgeport, Hartford, and more of that information will be coming up as the as it approaches.
That's fantastic. And I actually had all the actions listed. I just wanted to, so I have all the
Thank
links
you.
there. Yeah, I have all the links there, and we're going to send out a follow-up email to our entire mailing list with all of these. So we've got the phone banking, which people can do Wednesday, the 9th, which is tomorrow, 9 a.m. to 11 a.m. to help confirm people that they'll be available for giving testimony. And then it'll also be in the evening tomorrow night from 6 p.m. to 8 p.m. And you guys have scripts and materials and you'll provide training. I'm pretty sure everybody here has phone banked at some point in their life. Are you still doing the texting on the 10th?
The text actually, that's a good question. We do have the text banking and do, Sivan, are you looking from the email that Camila sent? Okay.
The yesterday or the day before.
Yeah. So yeah, whatever that says. I haven't I haven't had a chance to look over all the communication emails that have been sent out. But yes.
And then do you also still need interpretation volunteers and emotional support volunteers?
So yeah, so the emotional support volunteers are just for folks that have those skills as well and are bilingual. That one's is a little bit more specific to skill base. But the text banking and the phone banking will be really appreciated if we get more volunteers though.
Excellent. So we put all of that in the chat here, if you can see. And again, we will send out the follow-up email with all of the links as well. So I just wanted to thank you, Katia and Brigith, one more time for your incredible work. Katia, we have known you now for 2+ years and you're just tireless. It must be your young age that you do as much as you do. And Brigith, I really hope that you are able to continue your studies and continue your work on this because you are really fantastic at all that you do. Please, everybody here, share all this information that we have included here tonight on your social medias, your emails. Ask your friends and families to sign up to testify. This is incredibly important and a huge step in the right direction for us achieving universal single payer for every single person. Again, thank you to Husky for Immigrants. Thank you to Connecticut Students for a Dream. Thank you, Katia and Brigith. And we thank all of our members for showing up tonight. We will see you next month. Or if you have a chance, sign up for one of our committees or working groups. Check out our website, check out our social media, and please consider making a donation. Okay, have a good night, everyone.
Thank you. And sorry, I was typing with my mic on. I wrote something else because, Sivan, I think it's crucial because these deadly arguments, you know, who knows, maybe the bill is already dead in their mind. They've made plans to block it or kill it, whatever. But to put them on the spot with counter arguments, yep, is putting them on the spot. And politically speaking, because then you can use it in future campaigns. Oh, they said this, we said that, and yet they still refuse to pass it. You know, it's important. I mean, this is a political arena, right? So use politics against the politics. You know, that's what it is sometimes.